Hello, my name is Evan White. Today is Thursday, September 18th, 2025. I'll be giving this presentation without any notes. In this presentation, I'll be describing 11 terms along with an example of each term. The first term I'm going to describe is the definition of a disease. A disease is an illness that is either present when one is born or develops over the course of their life that causes physiological dysfunction. An example of this could be sickle cell anemia, where someone is born with an abnormal genetic presentation, which results in a misshaped hemoglobin protein that causes a change in the shape of a red blood cell that could impact the body's ability to clot bleeds. Disease classification refers to how we group different types of diseases together. This is often done by either their cause or by the physiological impact that the disease has. One example of this could be a genetic disease, which is characterized by the presentation from a genetic source, such as in the case of cystic fibrosis, where due to a genetic abnormality, proteins are misshaped that can lead to physiological dysfunction in the neural system. Next, we have etiology. Etiology refers to the causes of disease. These could be biological, physical, or chemical agents. One example of a physical agent for etiology would be UV light. When UV light hits the body, tissue or DNA, it can result in cellular or genetic damage to the DNA that could progress onwards towards dysfunction such as cancer. We also have pathogenesis. Pathogenesis describes the course of development of a disease after exposure to an etiological factor. One example of pathogenesis could be in Creutzfeldt-Jakob disease, where a misshaped protein of the neuron is introduced to the body that is pathogenic as a prion, where it's able to misshape other proteins within the neurons. The progression of this would be exposure to the prion. It would lead to neuronal cell death. It will then lead to neurological deficits, and then finally in death. That would be the pathogenesis of Creutzfeldt-Jakob disease. Next, we have symptoms. Symptoms are the subjective complaints voiced by people with diseases. These are not directly observable oftentimes. An example of this could be someone reporting to be lightheaded or dizzy, as opposed to a sign, which is an objective indication of the presence of disease. One example of this could be in the form of the skin color presentation, such as if it were cyanosis, where there's insufficient oxygen exchange to the tissue, so it appears blue. Then we have a syndrome. A syndrome is something that has commonly occurring together sets of signs and symptoms. One example of this could be alcohol withdrawal syndrome. In alcohol withdrawal syndrome, you'll often see people have nausea, vomiting, they'll feel shaky, they may have different types of agitation or hallucination, and they could have an increased heart rate. Next, we have diagnosis. Diagnosis is the designation of the cause or nature of a disease. An example of this could be if someone presents with pain in the lower right quadrant of the abdomen, pain on palpation, or inflammation inside the appendix, they could receive a diagnosis of appendicitis, a name given to those signs and symptoms. A diagnostic test is something performed to validate or disprove a diagnosis for a given disease. An example of this could be a rapid antigen test in the case of like a nasal swab to determine if someone has COVID present in their system. Next, we have complications. Complications are adverse medical effects that occur during the course of treatment. One example of this could be if someone is experiencing cardiac arrest and they're receiving the treatment of chest compressions. A complication of those chest compressions could be the fracturing of ribs. Lastly, we have prognosis. Prognosis is the timeline of the course of the disease. This could describe onset to conclusion of the disease, if there's a conclusion to a given disease. It can also describe when to expect the onset of different signs and symptoms. For an example, in the case of the common cold, it is expected to last between 7 and 10 days from the first indication of having the cold, and it's expected that the signs and symptoms will peak between days 2 and 4. That is all for my presentation. Thank you for watching.